Okay, welcome back. So we're going to start the next session, which is more on discussing why should we go for blended learning. So it's to set the stage for the subsequent session in which how we're going to move forward with blended learning, okay? So to start with this, no slides. No slides. That's for Donnie, that's for afterward, so no slides. That's fine. Okay, so to start with, I'm going to divide you into two groups just for a very quick discussion and to split you from your countrymate. You've been sitting too close to your countrymate for 3 days. So I'm just going to give you a number. 1, 2, 1, 2, 1, 2, 1, 2. You're not. 1, 2. Okay? So that's group 1, flip chart. That's group 2, flip chart. Okay? So your task is simple. For group 1, in 5 minutes, just try to write down as many as possible reasons why we should go for blended learning. Okay, that's group 1. For group 2 is that we recognize that to go with blended learning, there are challenges. So list what are the challenges if we want to move forward with blended learning in the region. For example, in Latin America, in Africa, what would be the challenges to roll out blended learning in your regions, okay? So that's all in 5 minutes. So just go to your flip charts and start listing them, and we'll discuss them very quickly afterward, okay? So group 1, group 2. Group 1, why we go for blended learning, why should we go for blended learning. Group 2, what are the challenges to move forward blended learning in our regions. You have the marker, just write on that flip chart and we'll go around and have a discussion in 5 minutes.
Good morning, everyone. How was your last night? Yeah. Well, good rest. So before we start our salsa lesson, there is someone that I would like to introduce, our colleague from RTC's West Pro. Sheila, would you like to introduce yourself and then?
Hello, good morning. I am Sheila Luz Punsalan from RTC Philippines. I am the RTC coordinator there. And I just arrived yesterday. So I am glad to be with you on the last day of the workshop. So good morning to all of you.
Thank you. So it would be nice if Sheila can have an opportunity to also talk to all the RTCs, so that can you say your names and from which RTC from each of you. Please, no need for Philippines. Oh, you just met? Really? Wow, then okay. Please start. Okay. So shall we start with the role?
I'm Wafa Kamoun, the project manager of the RTC for the East Mediterranean region at Institute Pasteur of Tunis. Nice to meet you, and I hope we keep in touch because we have the same job in RTC.
Good morning, welcome. And so I'm also from Tunisia. I'm a medical doctor and epidemiologist working in Tunisia.
I'm Vara. I'm from India. I kind of work with multiple RTCs. I'm an independent consultant.
Hello, my name is Maria from Colombia. I'm from CDEIM, the RTC of the Americas, and I'm working right now in the training, building capacity area in CDEIM, and particularly with implementation research.
Hello, my name is Maria, again, Delmar. I'm from Colombia too. We come from CDEIM, from the Latin America and Caribbean RTC. I'm a physician and epidemiologist, and my main area of expertise for these courses is GHRP and GCP.
Hello, welcome to Jogja. My name is Lutfi. I'm from Center for Tropical Medicine, UGM, Universitas Gadjah Mada, and I'm a research assistant there.
Hi, my name is Ucha. Same with Lutfi. I'm from Indonesia, to research assistant from TropMed, UGM.
Hi, my name is Phyllis from Ghana, the RTC for the African Regional Training Center. Thank you.
Hello, I'm Franklin, also from Ghana, School of Public Health. I'm a lecturer there.
So thank you very much. And
hello, I'm Ari. I'm from Center for Tropical Medicine, UGM.
they both our collaborator in developing this blended learning. Thank you.
Actually, the purpose of my visit is so that we could learn from your strategies and best practices employed in your respective RTCs and countries, since the Philippines, the RTC Philippines or the WIPRO has been operating for years. However, the participants mainly come from only within the country, researchers from within the country. But of course, the ultimate goal of the RTC is to capacitate the researchers in the region. That's why we would like to learn from you and from Dr. Doni's group on how we could upscale our operations and establish networks from the countries in the region. So I look forward to learning from you. Thank you.
Thank you. So now, will it be a salsa or? Oh, the afternoon, okay. So you want to do it this morning? You want to do it this morning, Machi? Okay, so we start with the presentation from yesterday. So who wants to? Ghana. We fly to Africa.
Okay, so I'll start with the study design. For the first objective, this will be non-interventional, but the original study will be interventional. It will be analytical, cross-sectional, and we shall use a mixed method, specifically a concurrent triangulation. So we're going to use the systematic reviews and the interviews to conduct the survey. So that's why it's going to be concurrent triangulation in terms of the mixed method. Okay, now the study methods matrix, for the first objective, which is to explore awareness, knowledge, and perceptions of cholera and diarrhea-related diseases. We think that the study outcome will be adoption, which I use two methods, qualitative, as well as systematic review. For the qualitative part, we're going to use purposive sampling to get these food vendors and so on. And data collection to be the interview guide, analysis to be thematic analysis, and the data presented in the form of excerpts and themes, sub-themes. For the systematic review, sampling, going to look at all studies, papers, and medical and health-related databases. First and foremost, we start looking at Ghana. If we do not get enough, then we try to extend it to sub-Saharan Africa, generally. The two will be the extraction sheet, data analysis with systematic review, and then we use the Prisma for the presentation. For the second objective, which is to determine the proportion of households that practice WASH, we think the outcome will be coverage. That will tell us about coverage. The method will be quantitative. We shall use a systematic random sampling method. And the questionnaire will be used to collect the data. We shall perform statistical analysis. And then the data presented in the form of tables and graphs. For the third objective, which is to describe patterns of health-seeking behavior for diarrhea-related diseases, we think that the outcome will be acceptability. And the method will be quantitative. The sampling strategy will be a systematic random sampling. Again, we shall use the questionnaire to do this. For the data analysis, again, statistical, which will be presented in the form of tables and graphs. Okay, so the last one, the dissemination strategy. The first one, the objective will be to educate. The target audience will be community members, and this will take the form of a DEBA or town hall meetings. And this will take place, it will be integrated in the course of the project and also at the end of the project. And well, this part wasn't very clear, but then we think that for assessment of information use, improvement in watch practices within the communities will tell us this. And tools will be through documentaries and plays within these town hall meetings and debates. The second objective will be to sensitize. In this case, we shall target the implementers in the form of workshops. And again, it will be integrated and at the end of the grant. And we think that improved health services will be a way of us knowing whether this information has been utilized. And the tools, an information sheet that will be presented to these implementers. The third objective will be to inform policymakers, and this will take the form of meetings and seminars. And assessment of information usage will be, we think, in the form of policy changes. And the tools will be policy briefs. The fourth objective will be accountability to funders, and this will be in the form of meetings. And assessment of information usage, we think that those will pave the way for more funding, hopefully. And this will also be in the form of progress reports and end of grant report. And the final one will be objective, will be to update, in this case, stakeholders. This will take the form of dissemination seminar, end of grant, and it will be integrated as well. And we think this strengthened collaborations and also in other areas of health will be an indicator of information usage. And this will be the form of presentations in this stakeholder meetings and engagements. Okay, so that's the end of it.
Thank you. Thank you very much. Any comments, clarification, inputs? Farah? Farah? Oh, Maria. Okay, please.
I'm not so sure the dissemination to your peers as the scientists too in the dissemination strategy, other papers and in the.
Can you repeat that? Can you repeat it? I didn't quite hear.
So another target, which is the more obvious for us, is the scientific community, so our peers, our colleagues.
Yes, yeah, I agree, yes, that's true. I think it's not here. It's not here, yes.
Because your study itself starts with a systematic literature review. So if somebody did not publish, how would you be able to do a review? So how important it is for us to publish. So yeah, that was one of mine. Anybody else? The other thing is, I remember you said on the day one that it's not just the healthcare providers who are your stakeholders, because we're talking about WASH strategies. Could be those who are like the public administration, the ones who are maintaining these communal toilets or water provision, because a lot of things may go back not to individuals, maybe even infrastructural, the fact that there's no water supply, that there's no communal toilet. So I don't see, you might find a lot of results which may not be just pertinent only to the healthcare services, but may go beyond. So you need to first look at who your stakeholders are and how you inform your various stakeholders. Because I remember on day one you said what is that, housing, water, sewage, and all of them. So I don't see that here in your dissemination.
I think what we were actually looking at was grouping them together as stakeholders. But the point's well taken, because they would be of different categories.
Yes.
And then we need to format the information to suit their needs.
Yeah. So I think that becomes very crucial in a study like yours, more than the healthcare providers. Yes, cholera is what you're looking at, but then fundamentally we are looking at the WASH. So I think you need to give importance to them. Can we go to the previous slide? And in the last row, I see you say describe patterns of health-seeking behavior. So I'm assuming you should be having qualitative data rather than quantitative data. The second one is like determining proportion of households. So then there you can use quantitative. But third one, you're clearly saying I want to look at patterns of health-seeking behavior. How do I get that in a quantitative form? Or am I, if that's going to be quantitative, then should I have to redefine my objective to suit? Because yesterday I was talking to Dorothy, I said, but this matrix seems like little complex, but now I see how useful this matrix is because it helps you see across. And it's looking at, again, going back to quality, are they all coherent? So maybe I'm just looking for how.
Yes, I think we could just try to determine the pattern of health-seeking behavior.
You can use quantitative methods to do that.
Do we then use describe, or do we say something else? Because when you say describe, I am assuming, I mean, I may be wrong, but I think it goes back to the way we define our.
Many KAP using quantitative, and it's the pattern that we want to know about the practices, and it's a pattern in the community, not the phenomena, but the pattern. So that's with the quantitative. You want to add something, Hari?
Yeah, about the sampling, systematic random sampling for the cross-sectional study. Well, I'm thinking maybe actually like a multi-stage sampling with the application of cluster sampling may be more applicable compared to systematic random sampling.
Unless you have already sampling list, it's difficult to have a systematic random sampling. This is a slum, right? It's difficult to have a sampling frame, a good sampling frame. Yeah.
I think, was it yesterday or the day before, we had a presentation, I think Phyllis did that, about getting that from the EAs, the enumeration areas from the Ghana Statistical Service. So at this point, we assume that that is already there, and that's what we're going to use to get the actual participants from the households.
I think we can get it in some areas, but not all. There may be some thick slums that the EAs might not work. Yeah.
Okay, another comments? The next slide, please. Yes, well, I perceive that almost all dissemination strategy will be conducted in the end of the project. I'm thinking that actually like sensitization workshop with the implementers could be in the initial stage in your project, or maybe in the preliminary findings stage, something like that. So I think it makes their awareness about the project, and later on the adoption to your findings can be potentially better.
Any other comments, Dorothy? Oh, please.
I was just wondering for the objectives, I don't know how applicable it is for your study because it's kind of straightforward, but may I just give a suggestion? If I think it would be better if your objective is more specific, like to educate what, to sensitize what, yeah. Yeah, like, because, you know, different, if you have a particular focus to reach, you have to know what it is, and the method by which you do it will also depend on what particular information are you educating, informing, things like that.
Yes, thank you. I think we thought about that as well, and we said, because this is just, we are not, I mean, we don't know what we're going to find yet. You see, so it's just generic for now. But once, after the study has been conducted, now you know what you found. Then you know exactly what you're going to educate on, things like that, yeah.
Yeah, as Franklin said, I don't know how much funds. I think one of the key things that we also need to look at is kind of clearly make a budget line for dissemination, because dissemination is one of those key elements in an implementation research, be it publication, be it whatever, and a lot of times this is something that we miss, and then in the end we see we have to do a variety. You look at the variety. So I think that's something that we need to also think through. And I think this is just a starting point, and we also didn't give you really a lot of time. But this is just to tell you, like, okay, now I take this one, and then you need to go and dissect into each of those to see what all you need to do. If you had given us more time, or maybe we gave you more instructions, but I think this is like, yeah, it's a good start, yeah.
I just wanted the previous slide, just 1 or 2 points to make. One in this, of course, is the systematic review, I think, is above all of this, in the sense that you're not looking at adoption within your community by looking at a systematic review. So just to be able to think it through, I would have taken the systematic review out, and qualitative, you're looking at adoption within your community and the practices there. So, and the systematic review also informs your methods further. So I think that's one step above. That's, I mean, just my way of systematizing it. But yeah, whatever you're comfortable with. The other thing that I wanted to say about this was to ask you what your design was. So I know it's not one of the columns, but since we had a discussion on designs yesterday, if you were to say this as a study design, what would you say is your design? Okay. Right. So, and the thing with the mixed method here is that you are using one to inform the other. And that also should somehow come out in your...
I think we had stated there was a bullet that said that for the systematic review and the interviews, we want them to be concurrent together and triangulate. But for the purpose itself, it's going to be the development for the survey. So there was a bullet there that said development, so that you know exactly what we were using that for. Yeah.
Okay. And then I just wanted to make one point with dissemination, if I could just look at that slide. So the first one says to educate community members. I think with IR especially, it's important to go back and share your findings with community members. So most often our attitude is that we have to tell them what needs to be done, but I think IR really changes your position as far as how you view the community and how you are participating with them. These approaches are much more participatory. You're doing it with them. You're trying to find out things along with them, and not so much to educate and inform them. So I would change the objective of the first one to sharing your findings with them, discussing it mutually with them, seeing some solutions that may come out from their what they see and how they interpret your findings. And it's a much more participatory and mutual thing, yeah.
Can I ask you to go back to the first, this thing. For the third objective, describe patterns and health seekings, but why the study outcome is the acceptability? Acceptability of what?
We think that once we try to find the pattern of the health seeking behavior, there may be tendencies that they do in trying to seek for health. So we want to find out whether they consider the WASH practice, whether they accept it. So we are assuming that if they are not considering WASH and considering other alternatives as part of their health-seeking behavior, then perhaps they are not accepting WASH intervention. So that was the thinking line.
Okay, but when this is my, again, my assumption, when you have this survey, then you ask about their practices of health-seeking behavior. What you have is a pattern, but how can you measure the acceptability from those? So the study outcome should be the health-seeking behavior patterns. And then you may have one more step from that. I don't know what, but perhaps the pattern will be the context, right? And then you develop a package of intervention. And then on those, and then you can ask whether those package of intervention is acceptable and even appropriate for those kind of community.
Yes, exactly the way we are thinking. However, we wanted to see, because there are currently WASH interventions that are being rolled out, like the ordinary WASH, we wanted to see the extent to which they accept those through the patterns, and if that can inform how we design the interventions.
Or maybe utilization, something with utilization.
Okay, perhaps utilization, and also then it can have a bit different objective, because the care-seeking behavior is one thing, and then objective utilization of also health-related behavior, health behavior related to WASH is also another objective.
Okay.
Thank you very much.
Yeah.
Any other comment? Please, Mari.
Yes, but not specifically to the team, but in general, is that when it said study outcomes, for example, for us, we thought it was more specific. So, for example, let's say I want to assess the coverage, so then I want to estimate the proportion of houses, blah, blah, blah. So maybe it would be helpful if we can have some sort of clarification on that, because at the level of detail, it might help or not to the discussion.
Yeah, it is. I mean, if you can further specify, that's also, it's better. But as we see here, this is really study outcomes with specific to the implementation outcomes. So like fidelity, coverage, acceptability, those kind of implementation outcomes. Thank you.
It's a different dictionary.
Yeah, yeah. So we have to familiarize ourselves to those. Yeah. Thank you very much, and a big applause.
All right, thank you.
Yeah, so we are still working in our objectives. We reframe them. So just to be clear, we are saying that still we're going to estimate the effectiveness of standard treatment for cutaneous leishmaniasis, but within the national program in 3 municipalities. And we are using mHealth as a tool for collecting data. And our 3 specific objectives we frame as an indicators are: first, compliance to treatment and frequency of adverse events. Second, factors, we want to know to determine factors that influence, it means that hinder or that facilitate successful completion of treatment. And third, we want to determine the treatment outcomes in real life conditions. So, So our study is a non-interventional study, is an observational, analytical cohort study, and we will use mostly quantitative methods, but for one specific aim for determining the factors that influence, we are going to use mixed methods. So we, Oh, okay, I will move from one slide to the other one. So for our first objective, which is to determine the compliance, so we state the outcomes in the other way, and actually I wanted to make with you the exercise of how can we frame as an implementation outcomes, since we are not, we are exploring, we are determining, in this case, the compliance to treatment. So I will say, so we said that outcomes, we have treatment characteristics, compliance to treatment, and frequency, type, and intensity of adverse events. So probably it could be framed as coverage, I'm not sure. Fidelity?
Fidelity, right, Ari? If it's compliance. Yeah, treatment.
Okay. But
those outcomes is a big terms, but you can have different indicators to show that. And here you show the indicators.
Yes.
Yes, that's fine.
Okay, great. So for this, we're going to use quantitative methods. The sampling strategy is this first row. So we are going to do it in all patients identified at risk in townships. Our data collection tools are patient diary, reports form, and paper forms, and apps. We're going to use both. And we're going to do statistical analysis for this objective, and presentation in tables and figures. For the second objective, we want to determine factors that influence successful completing. So those are our outcomes. We will have factors identified by patients, by implementers, and also regarding accessibility, we will have availability of healthcare providers, cost, and acceptability. And for this, we will use qualitative and quantitative methods. Sampling strategy, again, all patients that have success, in this case, are patients that are completed the treatment. We will use clinical records, CRF, and interview guide as data collection tools. For data analysis, we will do both statistical analysis and qualitative thematic analysis. And the presentation will be tables, reports, maps. We are thinking that maybe maps could be a good idea to communicate. And for the third objective, which is outcomes to treatment of current treatment, our study outcome will be cure or fail of treatment. It's a quantitative. We will use quantitative methods. Again, in all patients identified at risk, using the same data collection, clinical records, apps, CRF. And for data analysis, we will use statistical analysis and tables and figures as presentation. Oops. Oh, yeah. And then our dissemination strategy, so we want to first create awareness in two different audiences. For local health authorities, because remember we are going to work with them in the towns selected, but also with communities, and we were thinking that we need to do this since the beginning, of course. For that, the best channel that we can use is face-to-face communication with them, meetings, and also participation in some program meetings. Not meetings that we organize, but also they have some special meetings, so we want to be part of that. Another objective is update or advance of the project, so with the steering committee, the funding agency, and the ethics committee. And for that, we will use written and face-to-face communications, and the tools will be progress reports and meetings. And we expect to improve decision making. Then we also want to, of course, contribute to reduce knowledge gap, to scientific community. So we will do peer reviews and participation in conference. And ideally, we want to have change in policy. So for doing that, we need to target the national program of cutaneous leishmaniasis, and we will do that with written communications and with meeting, and probably policy briefs will be a good way to approach them, and also meetings, which is the most effective way. I think that's it. Mari, something?
It is a great progress
Yes.
compared to yesterday,
Yeah.
because I were in the team and observing, and then I can see that this is really a great progress and hard work by the team. So congratulations. I have the comment about the objective. Well, I perceive maybe it is easier for the audience to understand the objective if you change the order of the objective. The third objective should be in the second. The second should be the third. Yeah.
Change it, yeah.
Yeah, and then
We
the
have
other
to.
and the other comment is about the dissemination strategy. Yeah, it's also relates to the you want to explore about the factors that hinders the success of the treatment, right?
Yeah.
So I think you also explore from community side, from patient side.
Yeah.
So I think for the dissemination strategy, maybe it is important as well to have a strategy focusing in the community. I mean, disseminate your findings to the community, because the barriers can be from the community side.
Yeah.
So thank you.
Thank you.
Any other comments? Dorothy?
Just want to add, we talked about several things that could be used for communication in the online classes. One of them was infographics. So for your first meeting, instead of only oral communication, maybe also distributing some infograph of the findings that you have, maybe something to leave back with them. Otherwise, what usually happens is you talk about all these things and go away, neither they remember it, neither has there been much impact. So putting something into the hand is always a good idea when meeting with national program authorities.
Okay. If you go back to the design, the next, yes. If I may suggest, if you have two different methods, quantitative and qualitative, you put it into different rows, because then you need to have different sampling strategy, and also especially what kind of data you want to collect might be different between quantitative and qualitative. And then, so it's more clear to the audience what kind of data you want to collect in the quantitative, what kind of data you want to collect in the qualitative, what kind of, those kind of things. So, thank you very much. So, other comments? If not, then big applause. And we fly west again to Philippines.
So let's just review our research questions. So first, what factors affect the success of adoption of G6PD screening and the use of WHO treatment guidelines? So second, what are the basic requirements needed to effectively roll out a G6PD screening program? And the third, will the use of G6PD screening and WHO treatment guidelines lower the incidence of primaquine-induced hemolytic anemia, or PIHA, and possible occurrence of relapse compared to the existing treatment guidelines of currently used by the National Malaria Program in the Philippines? So for the study design, this is a interventional quasi-experimental study employing mixed method. Quantitative experimental methods shall be used to compare WHO treatment guidelines and the National Malaria Program in malaria endemic area. So a mix of quantitative and qualitative methods shall be used to understand the factors in adopting the introduction of G6PD in those areas. So for the study area and setting, the recruitment of participants and sample collection will be done in southern Palawan, which has the highest number of malaria cases in the Philippines, and the processing of samples will be at the RATM. So for the study population, the inclusion criteria, so all malaria consulting patients in the health facility will be invited. And then for the exclusion criteria, pregnant women, severe malaria, and those 2 to 2 years old. So sample size and sampling technique. So this is a quasi-experiment. Will seek to recruit eligible patients who satisfy the inclusion criteria. So all malaria-positive patients will be invited to participate if they pass the inclusion criteria. So for the study variables and outcome measures, we have the first episodes of PIHA. Second is malaria antibodies, and then the factors of adoption of G6PD screening. So for the study methods matrix, for objective number 1, which is to determine the adoption of the rollout of G6PD screening and the use of the WHO treatment guidelines. For research question is factors affecting adoption of G6PD screening. So the study outcomes, number of patients agreed to be tested for G6PD among all the malaria patients who consulted the treatment group. And then for the research method, quantitative. And then the data collection tool will be patient log sheet and the case report form. For the data analysis, proportion of patients agreed to be screened, and then the data presentation will be table. Next is the perception of village health workers who will do the G6PD screening. So we will use the KII or key informant interviews. And then for the collection tool will be interview guides and data analysis using in vivo. It is a software used for quali research. It is encoded verbatim using to the in vivo, and it will show you the results. Okay, and then for the next is description of reasons for taking the screening test. So research method will be survey, and then collection tool, survey questionnaire, and then summary of statistics of survey answers. So data presentation will also be table. So next is the basic requirements needed to implement screening. So for the study outcomes, so description of infrastructure in village implementing G6PD screening. So research method will be the observation, and then policy recommendation, document review. So this will be all just written descriptively in the paper. So for the next, for the specific objective, to determine and compare the number of prima queen-induced hemolytic anemia in treatment and control group. So for the research question, will the use of G6PD screening and WHO treatment guidelines lower the incidence of PIHA and possible occurrence of relapse compared to the existing treatment guidelines currently used by the National Malaria Program? So for the study outcome, case group will report less number of PIHA compared to the control group. So research method will be quantitative experimental. Data collection tool, so the procedure that we will use will be hemoglobin count for PIHA and malaria, serology test to detect malaria antibodies. And then the data collection tool will be case report form. So data analysis, this will be consulted to a different department in RATM. They are the one responsible in data analysis and data sampling, or sampling size, for sampling size. So also the data presentation. So another study outcome is the case group will have lower to undetectable malaria antibodies compared to the control group. So this will indicate a lower possibility of occurrence of malaria. So same research method, quantitative experimental. So same. So next is the dissemination strategy template. So objective, to inform of research results. So target audience will be malaria program managers, provincial health officers and policymakers. And communication channel will be face-to-face meeting and stakeholders meeting. So assessment of information usage will be discussions with participants should show that they are aware of the key messages during the meeting. And then the tools will be meeting documentation. And then another objective is to contribute to public awareness on G6PD screening. So general, for the target audience is general public. So communication channel will be printed flyers, and then assessment of information usage, awareness of audience on G6PD screening will be measured using a survey. And then tools will be survey questionnaire. And for the last, to recommend policies based on the research findings. So target audience is policymakers. Communication channel will be research briefs, face-to-face meeting, oral presentation on conferences, and assessment of information usage. Research findings are included in consideration of updating the National Malaria Treatment Program or treatment guideline, and then the tool will be meeting documentation.
I just realized when they presented theirs, yes, I think for the tools, I interpreted it as assessment tool, which I think also is very helpful if you have a concrete assessment tool for how you will measure if you have actually let your message known to your target. However, I would say this is really difficult and cost consuming. So I'm not sure if this is what the table is for. Yeah.
Franklin?
Yeah. So I just wanted to know if this is really what was intended for this one. It's not for an assessment tool, so you wanted to see the tool for communication. Okay, good.
Well, I think she's clarified. I wanted the second, for targeting the general public, the survey question. I wasn't sure how that was going to be used.
Yeah, I'm thinking maybe really it's depend about the context of the Philippines, but in Indonesia probably for the raising of public awareness about G6PD screening, maybe using the social media can be more easy compared to distributing the printed flyers.
Yeah. There's no internet connection in Rizal. We actually have done that. We distributed printed flyers. Yeah. And there's no electricity as well.
So you had a table where you have a column on the analysis. I don't know which one that is, if you can go back. Yes, thank you. So for the first one, to determine as we go along, I see that you have qualitative, but when you got to the data presentation, I wasn't sure if it's the same in terms of the data that you'll be presenting from the qualitative. How do you intend to do that?
I think you're pertaining to the output of NVivo. I'm not a social scientist, so maybe Charm could answer more. The question I asked her was, how does the output of NVivo look like? So we weren't sure what to put there.
Yeah,
sometimes it puts the information in the table, but I understand that you could present it in a better way.
So the table would just be the output that it generates for you. But you need to go through about 2 or 3 steps more in analyzing the data yourself that is presented more in text. So themes and your own interpretation of what you are seeing.
Okay, thank you for that. But for the coding, we use table to better analyze or better understand shortly the information that we have gathered. So the table is just a guide or just a summary of what you have gathered in the field or using the questionnaire or the key informant interviews.
Just wanted to add to that, since I heard you also say that you will use NVivo for an analysis and it will create an output. NVivo doesn't do an output. It is not like a statistical software. NVivo is only a tool to help you sort, categorize, code, organize your qualitative data. All the work has to be done by us. So we have to analyze it, thematically draw out themes, even the categories that you give and assign is all done by us. So the NVivo does not work like a statistical package, and it does not take out an output for you. The output is you and how you interpret your data. Yeah.
In the last year, I had the exposure, and I felt like it's much easier doing it manually than doing it through NVivo. Because learning all that and being able to do seems like much more difficult, because in the end, qualitative analysis really, like you're the tool yourself to be able to do that. Very small exercise that we did, and I said, maybe this just is a fancy thing. It really doesn't add value for the money that it costs. Yeah.
It acts as a data management tools, and it helps you when you have such a huge narrative data. It helps sort code and those kind of things. Yeah. Any other comment? Just a bit comment on those adoption. I think it's just, again, terms in implementation research. There is an adoption, there is an coverage. If it is with the health providers, that's adoption. But if you go measuring with the community, the beneficiaries, that's the coverage. Just a bit of different thing. And also, if you go to the next part, I think you measure about this as a effectiveness, right? This one is a effectiveness of those intervention. It would be also good, for example, for policymakers if you add one component, the cost, because I think implementation cost you also have, and you can have those cost effectiveness, and it helps them also to scale up, for example. So it's just add component which actually you have already there, because you have the cost, right? Cost for implementation. Yeah, thank you.
Okay, we thought about that, but I think it also takes another expertise to do a cost-benefit analysis. And yeah, we were thinking of putting the implementation cost, but it's always a problem because it's hard to find, an economics major to do it for us. But that's a really good suggestion.
Thank you. Okay, so big applause.
So continuing our presentation yesterday, so we would like to present you our study design. We tend to do interventional step-wages design and with study method, convergent mixed method. So we gain the quantitative and qualitative data at the same time. This is the graph that show the first month, the second month, and the third month of intervention that we're gonna do in two of our groups. So to make it easier to us to understand which variable to be in the quantitative one and the qualitative one, so we explore this variable into the objectives. So we analyze all these variables based on the framework. So because we want to assess the individual readiness, we describe the variable into this one, and also we want to know about the organization readiness. We want to find this variable, acceptability, we found this variable, and also challenge and number of TB suspect, and that differentiate between two quantitative and also qualitative, also observation or document review. It's just to make us easier. So after we explore the variable, we go into the study method matrix. Thanks. So this is our so this is our study method matrix for the first objectives that we want to assess the effectiveness of TB screening agent. We we put the knowledge and also number of TB suspect variable into the outcomes. And for the knowledge outcomes, we will do the quantitative or survey methods, which will done by random cluster sampling strategy and done by the questionnaire. And the analysis, we put this one, both independent sample t-test or pair t-test, because we want to know the before-after effect. And the presentation will be shown in table of graph. And for the variable of number of TB, okay, it's okay. For the variable of number of TB suspect, we'll do document review with a report data collection tool. This is the quantitative descriptive that will be shown by table or graph. For the research question number 2, which is, for the second objectives, we would know how's the individual readiness and also the organizational readiness. For the individual readiness, this is our variable. For knowledge, we also want to do a quantitative method with random cluster. This is done in inmates. We will do with questionnaire and shown in table and graph, while the other variable will be done in qualitative methods. It's divided into FGD and also EDs for the organizational readiness. So for the quantitative, because we will assess the before-after, so the analysis will be done in independent sample t-test or pair t-test, while the qualitative will be done in thematic analysis. Additional for the organizational readiness, we also want to assess policy guideline or SOP for the outcomes that will be done by both of ED's observation and also document review. This is for triangulation of the data to make it more valid, and will be done by thematic analysis. Can you go more to the left? Thanks. Okay. For this third objectives, we want to know about the below. Scroll down. Yeah. We want to know. We want to assess acceptability of the stakeholder. So the research question will be how's the acceptability of the stakeholder, and then from the framework we differentiate that this is the variable. We want to know the experience, the extension, burden, ethically or opportunity cost, which is all done by the qualitative data. We will do thematic analysis and shown by the narrative or graph. While the last objective, to explore the challenge, we will do also qualitative data. The sampling method will be done by purposive sampling. This is done by FGD and also ID, because we will propose the stakeholder, like all the staff and also the other stakeholder. This is done by thematic analysis too. Right? Yeah. That's for the study method design. And also for the dissemination strategies templates, this is, for the first objective, we will do workshop in inmates to gain knowledge and improvement and also motivation. They will be done by leaflet, poster, and banner. While the second objective, because we want to gain the stakeholder engagement, we will do open discussion or advocacy by infographic or policy brief. While for the community research, we will publish this result of the research by manuscript tools. I think that's all.
I just noticed, from the the Excel file. I'm sorry. But by the way, your presentation is so good. We're learning a lot from you. But I just noticed you have a lot of FGDs and questionnaire. Do you plan to do that over and over again? Because I think, for one, the analysis you'll be, overloaded with data. And then another thing is, if you do it over and over again to the same participants, I don't know if that's feasible. Yeah.
So we think that we will do the FGD and also ED based on the subjects, based on the person, so it's not repeated, but just to make it easier to like describe the variable, so where to put in EDs and where to put in FGDs and where to put in quantitative questionnaire. Maybe Mbak Lutfi?
So the variables or outcomes, it is not like separate FGDs.
Okay, yeah, clarified. Yes.
Yeah. So very good, very impressive presentation. I just have a question. So what are your clusters? Because I got lost a little bit in the design. So why are you calling a cluster then?
First, for the selection of the prison, because we do like step which we need to cluster randomize which one goes first, which one later. That's the first one. And for the knowledge in the prison, there are blocks. So we the sampling is like select based on the blocks, because based on my experience, it was suggested by the prison staff, prison policymakers.
So the cluster is the blocks.
Yeah, for the survey, it's block by cluster.
Okay. Because just to keep in mind that the risk with this sort of design is that you can get contamination of the data, because if they communicate between each other, then that will affect the knowledge that they have. So just to keep that in mind when you have, because that's going to be affecting your result if you don't consider that.
Ari.
I want you just to clarify about the workshop for the image. So when it will done and where? I mean, you have two different prisons, yeah, in your study.
Yeah. For the workshop, we think that we will done it at the end of the intervention, and it is for the inmates that being the agent. Am I right?
Were conducted inside the prison. They have like a hall, and when it is after study finished, to sensitize, to motivate the other. It is for the general, not only for the agent one. So for the general, to sensitize them, to motivate them. Oh, this kind of things works for good. So maybe the other inmates will be motivated to do so.
Different one with the implementation strategy. Because actually this workshop can be also one of the implementation strategy. You would like to introduce that in the prisons?
Maybe we can assess it the next step after this study.
Okay, Frankie.
Just a follow-up, the same question. Are you going to have separate workshops, two separate workshops for the inmates and then one for the prisoners, or you're putting them together? Because you said the target audience will be inmate and prison staff. Are you putting them together?
So different. The objective is also different. For the inmates is to motivate, and for the stakeholders to gain support, to change something in the policy. And because yesterday we presented that we will also assess the sustainability, so we do like TOT. But in the meantime, we think again, we just remove that one because it will be bigger, the study. So we just stop until we train the agent one. So for the sustainability, we think like to socialize, so the other prisoners will be motivated. For the sustainability one, we cut that out from our objective.
I think the question was different. I think he was looking for clarification between the inmates and the prison for the same role as you have there, not for the next one.
When you have more than one target audience, just put that in one row because the objective is different, the way you do it is different. So you just need to split that horizontal row 2 into one more, that's all. Yeah. So there's more clarity.
Okay.
Just clarification on why you choose a stepwise design as opposed to a pragmatic trial.
Because we have two different prison with different settings. So the one is special for the narcotics prison. The other one is general prison. Based on the environment is very different, and the building, the facilities are also different. So we decide to do the stepwise because beside of we compare each other, we also can compare by themselves before and after. Is it answered?
Okay, maybe you can reconsider it and discuss it. I don't know if that's the ideal design for the kind of thing that you are thinking of. And maybe just a control and an experiment would be enough to show what you're trying to show. Just one other general comment that I think there are still too many things in there. Even just studying organizational readiness is a study in itself. So I think it's just the optimism of your age. But it's very heavy already with the number of things that you are trying to assess.
Thank you.
Yeah, I think just to add on those stepwise, when we use stepwise, we can learn from the previous implementation experience because it's an incremental. So that's also additional. And if you don't have big resources to do it incremental, it's also a good way. And also, as mentioned that by Lutfi, in stepwise that before it, you can use them as a control, so that you can compare before after. That's additional of stepwise. And I agree with Dorothy that it's already heavy, because when we talk about the Gantt charts it was in GHRP, and now whether it can be implemented within those time frame, you have to take into consideration and everything. And any other comments? Maria.
Yeah, so I agree in reconsidering the design because also the analysis is not simple. So it is, so for the analysis of these things, you have to take into account also the time, and based on what you have in the analysis plan is not considered there. So maybe a quasi-experiment can also be an option. Yes, so be more realistic, and I also think it's good to have to assess the feasibility of the study because it's a lot of work.
Thank you. Ari?
Yeah, yesterday the team also discussed about the design with me. I think they are somehow consider stepwise design because when they think about the quasi-experimental, they are afraid about the bias because of two different contexts, really different contexts within the prison. So that's something that maybe they want to have our suggestion as well.
Thank you very much. So thank you, a big applause. And now we go to the last destination, back to the root of our civilization in the North African regions.
So our presentation will look so simple comparing to the Indonesian, and since this is not our real project, but it's an exercise. So we will also go for an interventional study, a quasi-experimental one. We will compare patients from primary healthcare center where the intervention will be implemented, and patients from primary healthcare center without the intervention. And our intervention is the psychological supports and community education. So why quasi-experimental? Because our groups were not randomly selected. We will choose a purposive sample using the primary healthcare centers with higher number of patients having these psychological problems due to CL. And our selection will be done by the healthcare workers in these primary healthcare centers. Possible risks we may face. I think we are the only one who are, I don't know, maybe it's deleted, but we studied this. So we may face this healthcare workers not adopting the intervention, or patients or families not adhering, some cultural barriers, and some changes or conflicts in the study team. So we focused on our main objective, which is to assess the effectiveness of integrating our intervention in the national CL program. Our research question, so is this intervention effective? Our study outcomes will be the number or the proportion of patients having benefits from the intervention, and we will compare between our two groups. We will use mixed methods based on purposive sampling, like I explained. Our data collection tools will be a questionnaire, quality of life, satisfaction, or others for the quantitative data, and focus group discussion topic guide for the qualitative data. Our data analysis, we will use statistical analysis, so all the tests and the sophisticated tests for the quantitative, and for the qualitative we'll use thematic analysis, and we may use in vivo software. And lastly, so for the data presentation, we will use table figures for the quantitative, and text or graphic presentation for the qualitative. Finally, our dissemination strategy. So first, we will communicate our findings to the Ministry of Health and National CL Program, and to recommend to integrate this intervention at a larger scale. So we'll use policy briefs, press release during meetings and seminars. Second, we will communicate our findings to our colleagues, medical scientific community, especially the dermatologists and the GPs working in the primary healthcare centers, during workshops, meetings, using our research reports, publications. And finally, we will share our findings to the communities and to highlight the importance of our intervention and for the sustainability. We will use simple things like flyers, brochures, also newspaper, website for the more modern communities, and some meetings or communications. And that's all. Thank you.
Thank you.
So is it like for the purposive, for like the validity maybe? How is it?
Here, because purposive, why? Because we will select only people who have the psychological problems. So not all the CL. So we can't do random or something because we don't know if these CL patients have problems or not. I don't know this. Is it clear or because it's not an intervention for all the CL patients. No, it's only for CL patients who have psychological. So we must choose something like not random, you know, because if you do random, you might choose. We might select people who don't have psychological problems, and then how we will implement this intervention for people who don't have this. I don't know if this is clear.
I think the question really will be that among those who have it, how are you going to select them? is it going to be positive? You see, among the target group that you have, how are you going to select them?
I think in our case, first we have, we don't think that we'll have enough patients, or maybe I think that in a real context we will choose all the people who have these problems. Because Tunisia is a small country and we are going in these areas who are already small, so I'm sure I'm even afraid that we don't select enough people for to compare, and you know, it's not so it's only one region, and we might select all the people who have these problems.
Okay. Then I suggest that perhaps you start considering the possibility of just doing a qualitative study, because as you said, you may not get enough, and because you want to then conduct statistical analysis, the sample size will be very important.
Can you give us an estimate how big is those numbers? Just not to be accurate, but just to give us ideas.
I think less than 100, for example. For
less?
Yes.
Okay.
Because these centers are really small, like district level. So
this is not nationwide?
No. First, for our study, we will choose only the endemic areas, and then we will, if it works, it will go to other countries.
Okay.
Yes, so I agree with Franklin when he mentions about just because you can do a description of the characteristics of the patients that you did in the qualitative study, and that doesn't necessarily make it quantitative. It's just, I mean, it's because your sampling and everything is serving to the qualitative part, and you're just describing what happens, and it might inform maybe something later for the bigger study or something, because the generalizability of the estimations that you're going to get for the quantitative analysis might not be great based on that. That's the...
Yes, thank you. But I know, I agree, but since we will integrate this in the program and we will present our findings to Ministry of Health, I don't know for you, but for us, people like numbers. So they will say, how do you estimate the proportion of people benefiting from this? So that's why we are choosing to do this.
Yes, so yeah, I understand. It's just to present it to your peers, because one thing is what you will talk to the ministry, right? But if you want to publish this and you are having a non-probabilistic sampling and you are making estimations that might not look great, and it's just to make it clear, something like that. It's just, I'm not saying no, don't do it, but just
Can you add a site, for example, not only one district, but additional districts, so that the sample size can have a bigger sample size?
I think this needs another study before, so we might use this, depending on what we have, literature and other colleagues. Because this is an example, so in the real life, it will be another thing, I think.
I have a question. This has also been bothering me. I mean, do you look at sample size so strictly in an implementation research? Because we had this discussion in our TB research as well. And we had in that committee a lot of biostatisticians sitting and pushing for numbers, and the actual people in the field trying to say that, look, we may not get those numbers, but we still need to find answers. So I'm just like, I don't know, I'm just asking, when you look at scientific rigor, do you strictly stick to sample size numbers in implementation research?
If we use a design of quantitative study, yes, I think due to the rigorousness of methods, I think we have to define or calculate the sample size.
I think another thing when we talk about IR is that it's more about generalizability, because it should serve I mean, in everyday life, you have to take into account different things, rather than in clinical trial that we focus on the efficacy. So the generalizability, it's things that also makes the, what you call, sample sizes
Yeah, but we are also talking about contextual, because I'm looking at problems which are totally contextual. I face a given problem in this context where I really don't have this big numbers, but I want to find solutions, right? So sometimes we find challenges like that.
I think what they are sharing is a typical example of what happens between science and the reality. So when you are thinking science, you are thinking about how others are going to interpret your work and value your work. You want to publish, so that's the possibility. But if you go onto the ground and you don't have the numbers, what other science can you apply? Is the question that you ask yourself. What other science can I still apply with the numbers that I have so that my study is still acceptable? I think that is the question that you need to answer. We know that ministries will be pushing for the numbers, but you also want some rigor to present beyond just satisfying them.
I agree. And then we also need to talk about context. That for those contexts, it's described the phenomena. But we might also think other when we want to scale up, for example.
Yeah.
That's I think the debate will be.
Yeah, I could also just add to the discussion that I completely agree that the minute we use a design and we are saying that we are trying to show effectiveness, then our sample size, our rigor becomes very important, because this is something people are going to take as effective for a certain purpose. So you have to have the numbers to show that it is there. So it has to be scientifically very rigorous. If you do not have the numbers and you just want to explore, then you call it an exploratory study and you say that you are not looking for effectiveness, you're looking to see how this can be applied. So it depends on how you frame it, depending on what your numbers are, and there's still something valuable. I mean, each of these things has its value. Just your implementation experience, the implementation process is extremely useful for people in different contexts. However, when you commit yourself to effectiveness, then you do need to make sure that you have numbers to show effectiveness.
Yeah. Yeah.
I think the way they've framed it is okay. What they need to do is to go back and check whether they have the numbers. If they have enough people within the PHC to prove effectiveness, then the design's fine, and you can still do this. If you do not, then and you still want to pilot to see how it goes, then you do an exploratory study to see how it is.
Is this already implemented or not? The intervention? No.
In our example or in our country?
No, not. Even in this study site? Not yet, right? Okay, so separate. Okay. So if I may suggest that instead of directly goes to effectiveness, why don't we focus on the implementation processes? Like whether those intervention is appropriate or whether what kind of intervention package required, so that also those patient and health provider accept the intervention and those kind of things. So it's more on exploration on those issues rather than effectiveness directly.
A totally different topic, and they had to tweak it. So then I think they did it more from an exercise perspective. I think, but it's a lot of learning for them.
Yeah.
And they could modify the way they think is appropriate. Yeah.
To add to that, I think the possible risks that you put, they look like they can be IR questions or part of the research problems. Like the risks, you can actually study them, like adoption, that's fidelity right there, and then factors, context,
Yeah, also that's also something really into those IR, whether it will, how can it be adopted with those all cultural barriers and everything, those something that an IR issues. Further comment?
Yeah,
Maria?
but it was very nice that you put the risk of the design and the approach was very interesting.
Dorothy, you want to come?
Since you mentioned about the risks for the design, so I just wanted to add that these are real life settings and these are things that we have to state up front, and it's a good thing to think through what are the things we're assuming? We're assuming a lot of things when we get into IR projects. It's good to state them down as your assumptions. And it's good to state down what are the possible things that could go wrong. Of course, it's a risk mitigation and assessment like we do, but also thinking specifically for implementation. The other thing that I find with implementation research projects is sometimes not so rigorous the implementation, because we say it's not a controlled environment and we cannot control everything. However, the danger of that is that sometimes we don't implement in entirety, but we make conclusions as if it was completely implemented. And so there's a chance of making, so we have to be very, very careful in implementation research on whether processes have been adhered to, what actually has been implemented, and what kind of conclusions we are drawing. So just, yeah.
Yeah.
Different groups presenting different approaches, and I think you get very good ideas how you could go back and work and improvise your project. Yeah,
True.
it's nice.
So,
and interestingly, I thought, you know, what we are doing now, this piloting, to me seems like an implementation research. Like different stakeholders, you have participants, you have facilitators, you have like the organizers, then RTC being interested, me playing a role like being an independent reviewer, and then somebody as an observer. So I thought like this itself is a very classical example of an implementation research. We're trying to do it the way we want to and trying to look at what the challenges are, what went good, what went... Is it not? Yeah, this morning I was just looking
precisely.
at it. Yeah, each of us has a stake, each of us has a different role. Yeah, very interesting.
So you all become an IR expert in one day. Yes, thank you very much. I think with that, because it's already 10.
Session
Yeah.
on the IR.
Thank you very much.
Diljit, to our feedback, what we shared yesterday. It you saw for GHRP, but now we thought we could also do for the IR. Dorothy, I think you sit there and you take the lead.
Similar thing that we are trying to now understand for the IR experience that you've had. So I think the first point on it was about content, duration, what is the time duration, and what do you feel about that? And then maybe we can go through each of these. If you can already think, then we can go through them one by one. Yeah, so the first thing I think is both the online as well as the face-to-face. So maybe we could first think about the online. We did a 1-month online training. What are your thoughts on the interval between the online and the face-to-face? For IR, it was much shorter. For GHRP, you had done it 1 month earlier. So do you think this is like an ideal timing? You finish the 1-month course, within 1 week, you come for face-to-face? Or do you think there should be a greater gap or even lesser gap? What do you think about the entire duration of 1 month? Maybe these 2 questions we could tackle. You could share your thoughts, then we'll move on to the next. So we're talking online phase. We're trying to see whether the interval between face-to-face and online was appropriate, and whether the duration of the online itself was good.
Yeah, I found the classes in IR too long. I mean, the online phase per class is too long. It could have been like broken down further. And then I think there was an assumption that this will be done separately, supposedly, right? GHRP is a separate course, and then IR is a separate course. So if the duration, the interval between the online and the face-to-face will be the same as with the GHRP, I think it's okay.
Yeah, just to clarify that a little, you mean to say soon after GHRP, the face-to-face should follow? And similarly, soon after IR,
no, it's the IR.
Shall I first clarify? Okay. I mean, I think because we got you all together and we said this is like piloting and testing, we did this in a different format. In reality, it will be either the GHRP or the IR, and they will be run as 2 different entities. So I just want to make this point very clear, because this is not the fashion in which it is going to run in reality. So you will have a set of online classes. then there's a break, and then you come for either the GHRP or for the IR. So that's how it's going to be in reality, yeah? Yeah. With that in mind, yeah, please give your...
Yeah, so the time frame wherein the GHRP was rolled out, like I think that's 2 months prior to the face-to-face. Yeah, the GHRP was 2 months, so yeah. So say you have just 2 months. I mean, say you just have IR for the course. I personally would prefer having 2 months to study the IR if there are activities placed in there. Like if we plan to already answer some templates during the online phase, that would be useful, and then just discussed it on the face-to-face. Because I think some of the things like could be instructed just using a template, and then we fill it out. After the lectures on the online, we fill it out, we finish the expected output, and then we come here and discuss everything. But we need a lot of time for that. Yeah.
Okay. Yeah, 2 months. Any other?
So I think the timing was okay for me. So the duration I think was fine. And the interval was better because we came sort of fresh for this IR. I don't know, maybe it's on the next part, but it would be good to come back to the recommendation for the EHRP that having something that like the extracts of the class. I forgot the name of what we said, but the handouts, yeah.
Can I just add, just to give a little context, it's my first time to actually go to an IR course, so it's very introductory for me. But I think the advantage is I've already been a part of an IR in the past. So I was just drawing the experiences and then trying to connect it to the concepts. So I'm thinking if a person is completely new, for example, you know, the jargons like the feasibility, the adoption, I think we need more, depending on the audience. Like if it's already someone who knows IR, but, you know, just doesn't know how to put it on paper, I think the duration will be very different. I'm sure it would be so easy for, say, Phyllis to take it or Dr. Maria, because they've been through the course in the past. Yeah.
Yeah, I also agree with you. For the timing, 4 weeks is the minimum. I even suggest to keep the catch-up week because it's very, very useful. Yeah, and it depends on the audience, like you said, because we've been part of the IR MOOC of TDR, and it was harder, but also like many people will take notes, and so it needs time. So people to assess the new concept. So 4 weeks with maybe 2 weeks of catch up, one in the middle, one in the end, maybe it's good.
We also see that GHRP is more about good practices, it's more about common sense. But IR, I think, as you all rightly said, is about new jargons, new terminologies, new everything. So definitely there's kind of difference for the two.
And maybe we can add an activity where we can practice writing an IR proposal in the IR activity.
That comment of yours has been taken, and what we have already decided is that at the end of every module, you will have an activity where you already start putting your thoughts and ideas. So, and then you will come here with a template in which you have populated some contents. May not be the best, but there's something that you come with. So that, I think, we have really clearly taken that up. That's a very good suggestion.
Yeah. Just to add to that, I was waiting to make some of these points when we go to the teaching methods, but it's coming up. So, what we have found relevant, two things, is that for such training, we should be clear who the target is. Are we looking at those at the very basic level, intermediate, or advanced? It really informs the content. So I think we should be clear on that. That is one. And two, for whichever level, when it comes to IR, we have realized that people pick up the concepts through illustrations and examples. When you define, they still can't wrap their minds around what implementation research is. They can't be the most seasoned researcher, but they still are like, oh, I still don't get it. So illustrations help. Some of these just come with, for instance, you can pick one big example and then you put it into pieces, not case studies, but illustration and presentation. So as you are delivering the lecture, then you are identifying what an outcome is in relation to a bigger study and all that. And I remember very well in Colombia, after sessions, they are asking, can we have an IR study that has been published so that I read the details, like from cover to cover? What does it entail? The learning comes through examples. If you don't share examples, they still don't get the point that you are trying to show. So there are two things. So let's really be sure who we are targeting, and if we can use more examples and illustrations, that will be very helpful.
Yeah, I was going to say also that because I have the feeling that for the toolkit, the focus is more in the proposal development. And I think that in the online course, the concepts about what IR is and the key characteristic and the outcomes and those kind of things are kind of, are very, like we review very general without many examples, not much illustration. And then the last part, which is more the design and the communication and dissemination, is very long. So I feel that the how you say that, the balance, yeah, so the concepts are reviewed very, very fast, and then the other part is more intense. So probably for some, yeah, for beginners or for some audiences, I think it will be very important to strengthen the first part of the course, yeah. And with illustrated with examples, yeah, totally.
We were also considering, like, you listen to something, illustrations will definitely be added, but we're also looking at some kind of activities. So like the kind of activity that Dorothy did yesterday, she used the same thing, but she kept on tweaking, and then it's like testing. But this is not rote learning testing. This is really testing your application. So we were also considering maybe we have some of these kind of activities at the end of each of these modules. So you also listen, you've seen some illustrations, but now you try to put it into practice. And you see, am I getting the design right? Is it making sense? So do you think that kind of activities would add value? Because what Diljit keeps telling us is that it needs a lot of effort to put it into it. So we would like to know that this is something that you will like and enjoy, so then we will go ahead to put these kind of activities.
Whilst,
you get my point?
Yeah.
Yeah.
Whilst they are enjoyable, I'm just wondering how assessment will go, or if it's just going to be a reflective. So for other courses where even we allow students or participants to write out an activity, you're wondering, are you going to assess it, or is it just going to be something else just for them to teach?
Is more like reflection, but what he's also suggesting is learning. Suppose I didn't get it right. So then it says, oh, probably you did not get it right. And then it says, it gives you a rationale for why you're not right. Then when you're right, then it says, yeah, you're right, and this is the reason why it's right. If all of you can just go to the WHO's healthcare financing, there's a very nice module up on their WHO website, which has got these kind of activities. So it's like you have a simple case study, then you read, you have some choices. You can also move around the choices. Actually learning is more than assessment, is like learning. So then, you can just go through different options and try and see. But that really entails that we in the back end put a lot of effort creating those case studies which are meaningful, and then it also requires a lot of IT effort to get that whole thing. So we would like to know that that's something that will be of added value, so we can put in our effort on it.
Yes, I think it would be very helpful. I've taken an online course that has like self-assessment in the middle. it also engages you and it helps stimulate self-assessment, and it keeps you engaged in difficult topics because you're also assessing yourself. And for example, the one the one Dorothy did, I think it could also be applied to other topics that are technical.
I also like the idea because I'm thinking from the perspective of having to facilitate the, the online course. So I think it's a lot better maybe to invest the time in having a structured feedback than to have it something we have to as evaluate every time, because if we put something in the forum or whatever and we are not answering to the participants, that doesn't look nice. So it's better if it's something structured, they learn on their own, and that will minimize, because I don't know who will commit to be reviewing pages and pages if we have 50 participants.
Just to add on to it, when you say the effort is higher, definitely higher at the initial stage, but one of the biggest advantage that we have found is repetition is quite easy. You can just, in the next batch, you can just take this entire activity and put it there, and it's getting graded. And so the effort is quite high at the initial stage, but it just comes down, as Maria pointed out, that imagine giving feedback to all these activities. It's really a task, but when you create scenarios and give structured feedback, I think they also learn, and also we can create restriction that if they don't complete that activity, they are not able to move forward. So there is this motivation also to go back to the video, figure out what was wrong, try and figure this out, and then move forward. So we have found that quite interesting to implement.
And I think with this linking the online and the face-to-face is a comment that we are also getting on an everyday feedback. Yes, we are definitely doing it. But again, going back to what Maria said and what Diljit said, let's say if we say at the end of this module, you can start to think about what your design could be, what your methods could be, what your tools could be. But we will not be evaluating it there, because those are the items that you're going to be bringing to the face-to-face program, where it's going to be presented, discussed, and deliberated. So there's a risk there, because if we start putting things there, then participants may say, I have my designs and methods right, and write a note to the facilitator, could you just evaluate and let me know if I'm on the right track? That could get very heavy. That was a bit of a risk why we decided we kind of keep that off, but now we are getting a feedback that we should start doing the exercises as we go along. But evaluation of those exercises during the online will not take place. They will only happen when you come to the face-to-face. That's something that we have to imagine, the kind of questions that are coming up, and then only one or two facilitators is not going to be possible for them to handle it, right? So that will be something very clearly made up front, saying that you work on it and bring it to the course. Is that acceptable? Yeah. If you don't say, because it's going to be you who are going to facilitate in your own centers, right? Maria's.
Yes, I say it from experience, because we open for a GCP course, and there are participants who are not very engaged, but there are people who are really writing very long pages and pages of things, and then you have the duty to read all of that. So it is not straightforward. It's nice when you say, oh, we should do it, but then it takes half a day of your time. It's not, yeah.
Yes, I agree, and it's even better for the participant side, because when you limit the participants to you have 1 week to write this, it's very we had the experience of the IR MOOC. We started 15 and we finished only 2. Like all the people because they feel so stressed and they have so many things to do, and you say that by the end of this week you have to write a proposal or something. It's better to say think about it. If you have time, you can write. If you don't have, you can catch up the next week, and just bring it when you come to the online phase.
Just to share, I was kind of getting the problem of, for example, for this course, if you do not do one part correctly, then it's going to go to the other parts. Like if your objective isn't right, I think that's a huge problem there. So I think what they do in RTC Philippines, for example, for a grant proposal course, but this is not an online thing, they assign an advisor to each student, one or two person, so that that person would tell you if your research question is okay or is it relevant, so that there's like a check. So it's not necessarily the facilitator who checks everything. So the facilitator just really gives the input and facilitates the discussion. But when it comes to checking the work, usually the expert in the field is there. They coordinated with the experts to provide guidance to the students, because really it's difficult to write these things on your own if you're just starting. So I'm just sharing that for maybe you can consider it.
This depends on the human resources. For us, we don't have only like 10 people for like it depends on the teachers and
fortunately in the RTC they have a pool of advisors for research.
I think the advantage of what she's saying is we might not have it, but from what she's saying, we need to get the question right so that when you come and you are working through the methods, it's easy. Or else you come and it's so huge and you are now thinking about how do I break it, and we should consider that it's just going to be only 2 days. By the second day, you are wrapping up. So we might not have the human resource, but can we have something like a checklist that as they develop the proposal, they are matching it against, do I have this, do I have that, is it clarifying this? So they do a self-assessment of what they are writing up, just to make sure that the grounding is good before we come to do a lot of the writing during the course.
Toolkit already providing a lot of that kind of support. The toolkit, the IR toolkit, they spend a lot of time on how you formulate your research question. There's like really a lot of guidance there, isn't it?
There are also, but I think what Phyllis mentioned, correct me if I'm wrong, that if you, with their perception and they try to develop those, whether it's really right or not.
I also agree, and I'm just wondering whether, at least for the research question and the objective, if that is something that can be looked at online, then we don't waste time in the face-to-face getting the question right. So I think that's a critical step that maybe could be addressed in the online itself before we come here. And we could look at that.
So that we can have online feedback up to the research questions. Yeah.
I think almost covered that, as well as the duration for face-to-face. Any thoughts? 2 days enough? Can be shorter? Should be longer? 2 days is good? Yeah. Okay.
Excuse me, 2 days of what? So, yeah, so I'm thinking, seriously, 2 days of registration, 2 days of getting to know each other. In there, we have lunch, we have snacks. The last day, half of it goes into closing and wrapping up. So 2 days of.
What we think could be an ideal agenda. So we discuss on that. You have still time to discuss on that as well.
The idea is that first we have 4 days of IR workshop, classical IR workshop that we did. But then a lot of participants said it takes too much time, right? But reducing only 1 day doesn't make any difference. So we think we may reduce up to 2 days so that we experiment with that. But whether in the end it's the right time or not is something that we need to think of also.
I think it also depends on your number of participants. Because if it's a smaller group, something like this can be accommodated for 2 days. But
we also decided we won't have more than 5 teams. 4 teams is the most ideal. 5th, depending on whether it is, so it's like 4 groups. You can have in each group 3 or 4 people, that's okay. But that's kind of, I think, fixed. No more than 5, yeah.
Yeah, so that's getting me thinking. So for 5 groups, 4 groups, we should be able to do a lot of online work for 4 groups. I think that we should be able to do a lot of online work before coming.
So when you say we should be able to do it, you are saying it should be more facilitator intensive?
Exactly, at the online level, just to make sure that things are at the level that when they come, it's easy for us to just push them to the level that we want. Because you have, like interaction is going to be much more limited than we thinking about the MOOC, for instance, where you can have over 500 or whatever. So this, I think, is quite limited, should be able to manage, yeah.
But in the MOOC, the outcome not a proposal, right? It's more on knowledge. So that's different, and then it also almost impossible to have those large number of, yeah.
So well, when you show later the agenda, then we can discuss on that, but I agree with the comment of Phyllis in the sense that, for example, if it's on the design aspect, there are courses for that. So then where is this workshop filling a gap that is not covered by others? So, because with 2 days, we will not reach the level of, I don't know, giving enough input to make a good design for a study. That's not, in my perception, not realistic. If the analysis is going to be good, if it's feasible, there are so many things in terms of, for example, design of the study, unless you're getting a very highly qualified team. And then, so maybe it would be good then to see what is really the gap that we need to fill in these discussions that are not being covered by other sorts of trainings. Or if we have, like, for coming to this, you need to have this and that background. That's another option.
And I think that's also in the regular IR workshop, that's what we aim, that it's not really, well, it's not really a rookie scientist. They already know some research methodology and those kind of thing, so that it's not research method, quantitative and qualitative research method. It's just that there are research methodology that we can use for the IR. And if you want to know more about quantitative research methodology, there's another course, and you have to on qualitative research methodology, there's another course. That's, I think, yeah.
I think we need to define the scope and what can be achieved within this workshop. That's number 1. And one of the things we encourage, be it for GHRP or for IR, is a team of people. A team meaning people coming with different expertise. So we don't expect everybody to have all the knowledge that is anticipated. So you may have one person who's more a scientist who will be able to help you with all this. And then there may be another one who's like the actual implementer who will be. So in the end, I'm also not sure if everybody should get all aspects right. That's not what we are looking at. If as a team, you will be able to get an idea, I think that's kind of good enough. Because I'm not sure if implementers will be really good researchers, having very good idea about data analysis. There will be some limitation. They may not know. But you still need them in your team because it's with whom you have to work, right? So for the IR, I don't know. Yeah, but we have to think through this. It's a very
Yeah, I think that's
important point that you are raising. Yeah, but we draw a limit and say this is the scope of this training. This will be covered. Because as he says, it's not going to be talking about research methodologies. A lot of people come thinking that we're going to be teaching about research methodologies. That also goes back to the fact maybe we put criteria, participants who have done research, who have already idea, some basic knowledge about research methods and about all this is essential. Because sometimes they come with expectations that we teach them all this and they are unhappy. That we say this is the scope, this is out of your scope. Yeah.
One question, I think that the toolkit, it says that it is a requirement to have the MOOC first in some part. So I'm not sure if it's part of the, maybe we want to think about that.
No, I just wanted to add to the previous discussion, which is I think, yeah, we need to think very clearly of what is this face-to-face trying to achieve. So in my understanding and in the previous workshops experience also, I think it's not so much to get out a perfect protocol at the end of it, because that is not realistic like you say, but it is to set people on the way to do that, to ensure that they've got concepts. And I think the discussions is something that no online forum achieves in the richness that you do it in face-to-face. So I think it's learning from each other's experience, it's learning from different examples, and it's the facilitation of discussion in the online thing that I think is more valuable than having a protocol at the end of it, because that really is not completely feasible always.
And from my experience, just to reiterate that, when they are walking away and they have a confirmation that what I've started is an IR project, they are fine. It might not be completed, but then they know they've gotten the concept right, and they will move on with it, yeah.
And also, since there was a discussion on what kind of backgrounds people should come with, so I think we've done it in India, people don't have IR experience. Some of them actually are at the very initial stages of their research careers. So what's more important, I feel, is the intent to do IR. So if they definitely have the intent to go back and do IR, I think that's enough, because then they do need to know all these things before they embark on it. So in the Indian experience, at least, what we found is that if they have the capacity and the intent to do IR, then it's good enough that we then take them on and train them, and they will come at different stages, and we have to accept that.
So it means that we have to have requirement like a motivation letter or something like that, in order to be able to assess that. Yeah. Yeah, and I'm agree about the discussion that actually in this implementation research course with online and face-to-face, maybe it's suitable for the intermediate and advanced researchers. And for the basic, I think the basic course about IR, it can be in the MOOC. Yeah.
So maybe some entry-level kind of assessment can be done online itself, and then direct those who need to go to the MOOC, and the rest to stay on to the online. Okay, any other thoughts on the teaching method? Some things, of course, have come out very clearly, which is that we need to put in more examples. There are not enough just now. We need to have maybe an exercise where they can continue to work on the different aspects alongside. Apart from that, any other thoughts on what could be good group activities, or do we even need any of these other things?
So I like very much the exercises, because I think it actually helped me to clarify my confusions about the scope of what is IR. So it's really very helpful to think through an actual project. So I think the exercises were very good, very pertinent. Maybe the first one, if we had, we already have talked about it, right? So having, as Phyllis suggested, having a checklist that this is really what I have, then it might facilitate the first exercise. But I think the others were very pertinent, and I like them very much.
to strike a balance is also difficult. The kind of comments that we receive is like, some say we want to have recap. Some say, but why are you recapping? Because it's already been taught online. And then some say, why everything is activity? Can we not have something more? So sometimes it's also like, from the organization perspective, it's so challenging because different people come with different perspectives, and we really have to accommodate. So in reality, you will be receiving these kind of feedbacks when you are doing it as well. But to swing one way or the other will be a big challenge, and we have to really find that balance. It was very interesting. The plus and the minus will be just the same. So somebody says, recap is very interesting. Somebody says, no, we don't need recap. It's just waste of time. We can spend more time on exercise. So, comments and suggestions. We still have time to come back when Dhoni is going to be doing the ideal agenda. So let's break for coffee.